Death certificates are a tool for understanding how and why people die. This information is important both for families, loved ones, and public health. The following slides will provide some basic information on how deaths are certified and reported. There are two ways that deaths associated with COVID-19 are counted by the New Jersey Department of Health. Public health departments employ professionals called epidemiologists, who are like disease detectives. One of their functions is to investigate cases of infectious diseases to identify people who may be at risk, make recommendations to control the outbreak, and enter information about the person and their disease into a database. So the first way that COVID-19 associated deaths may be reported is by way of a public health investigation, sometimes also referred to as disease surveillance, where the health department is on the lookout for reports of people who received positive test results. For example, if a person had received a positive test result for COVID-19 and died from the disease, the epidemiologist may directly record the information about the death. The second way that COVID-associated deaths are captured by the New Jersey Department of Health is through the vital statistics system. At the time of death, a physician completes the cause of death section on a death certificate as part of the process of certifying a death. Here is what the cause of death section looks like on a standard U.S. death certificate. Part 1 is for reporting a chain of events leading directly to death with the immediate cause of death, the final disease, injury, or complication directly causing death on the first line, and the underlying cause of death, which is the disease or injury that initiated the chain of events that led directly and inevitably to death, on the following lines. Part 2 is for reporting all other significant diseases, conditions, or injuries that contributed to death, but which did not necessarily result in the underlying cause of death given in Part 1. For example, here is what a completed cause of death section on a standard U.S. death certificate would look like. After writing in the cause of death, the death certificate is sent to the state and then sent to the National Center for Health Statistics, where a code is assigned to the text written in the causes section of the death certificate. These are known as ICD-10 codes. Based on the order in which the causes were listed, the underlying cause of death is assigned. Underlying causes are routinely reported in the standard death statistics reporting. The coded information is then sent back to the state for inclusion in the death registry system. Both are valid methods for counting COVID-19 associated deaths, but they use somewhat different definitions and sources of information, so the numbers they produce will be different. The first method, where deaths are counted by disease investigation, usually happens first and provides data for real-time surveillance purposes. The second method, through vital statistics, is a slower process that can take several days to several weeks. However, it produces more accurate statistics in the end, as it will include those both presumed and confirmed to have COVID-19. You may notice that the death count that the media is reporting may not match the number that you see on a national or state website. Several reasons that are important to note for these discrepancies are that death certificates need time to be completed. It takes extra time for the National Center for Health Statistics to assign ICD-10 codes when COVID-19 appears on a death record, and multiple systems use different definitions or methods for counting deaths. It's to be expected that counts may fluctuate over time as records are received and processed. Death counts can also change as errors get corrected or as states report to other states their residents' deaths. Likewise, death counts across states are difficult to compare on any day because some states report deaths on a daily basis while other states report weekly or monthly. To learn more about death certificates and how they are coded, visit the Centers for Disease Control COVID-19 Death Data and Resources page at the web link on the top of this screen. This website contains helpful information and resources, including a one-page guide to understanding death data quality, which you can access from the link on the bottom of the screen.